This is Jerry Hesch from the Hesch Institute in Aurora, Colorado. And my client drove through the Colorado snow for 6 hours to get to me. And yesterday we treated a twist of his entire pelvis, which had blocked movement on the left side in terms of forward rotation and upward glide. And I named that posterior rotation based on landmark palpation, but also based on that lack of movement. And I explained that that's the whole pelvis twisting. It doesn't mean it's happening inside the SI joint. In fact, the asymmetry is, much greater than the 2 degrees of rotation that the research shows us. Today, that moves normally. I can spring his pelvis forward. I can glide it up on the left. But there is a pattern which I call osteopathic inflare outflare. I have a separate pattern called type 1, or it has more of an anterior posterior component. You can look at YouTube video on type 1 inflare outflare. The type 2 was described by the osteopaths, and I use a different way of testing. And basically with the type 2, you will have medial glide when the client is prone, okay? But on the left side, but it will be lacking on this side, okay? And pardon me. How you doing?
I'm good, sir. How are you?
Thank you so much.
Have a good day.
Take care. It's nice when they knock on the door. Okay, so they'll lack spring mobility here. And again, I'm not saying this is in the SI joint, but what I am saying is it might be external to the joint, but it blocks movement translation through the SI joint. Okay? And then when the client is supine, they will have spring mobility going medially on the right, but not on the left. And one of the reasons I'm filming this, and I appreciate my client allowing me to do so, is because I just recently switched from doing this testing in sideline, laying on the left side and springing the front and the back, and then laying on the right side and doing the same thing. And so I just switched to doing it in supine. And so now my forearm is parallel to the floor, okay? And then I can load it. And I see his pelvis move, I feel it move, and I can spring it. And it springs to the left. And now I'm going to do the same test on the right side. And now there's no give. I can't take up the slack with a reasonable amount of force, very similar. In fact, I'm using a little bit more force than I used on the right side. Do you feel the difference?
Yeah, totally blocked.
Okay, good. On your stomach? All right, so then what I do is I isolate the posterior ilium. Okay, there's the top of the ilium. And if we wiggle around, the PSIS is right there. So I'm going to capture part of the ilium above the PSIS and part of it below. And I'm trying to compress it, and there's the slightest amount of movement, and then it becomes blocked. And I'm trying to spring it, and there is ever so little movement in that direction. So we isolate the PSIS on the left side, and then we do the same test, and he has force transmission through the joint, and there's free movement. Okay? So the way that I restore movement here is that I have the person lay on his right side, so go ahead and roll over. And I like this 2-inch foam. It's 2 inch tall. It's a half moon shape, 2 by 4 by 8. Okay? And I have you roll forward, and I find that PSIS again, and I put it on the back, on the posterolateral aspect of the ilium. And I have them lay on that for 3 minutes. Okay? Then I have them lay on the other side. So let's have you lay on your back. And what I then do is I put the flat part against his pelvis. So here's the ASIS of the ilium. So I cover above and below that. And it's the top of this is in the plane of his pelvis. Okay? So you're going to lay on your right side on top of this. So roll over onto your left side. Yep. And keep the bottom leg straight. Nice. And that's it. Okay? And so we have you lay on that for 3 minutes. And some individuals find that this reduces their pain. Others don't notice any difference. We could do some muscle testing and we would probably encounter a subtle difference side to side that improves when we treat this. I've certainly found that with the other type 1 Inflare, Outflare. But sometimes it seems very relevant to their presentation and other times it's just an interesting finding. Anyway, I hope this is informative. Thank you.